Good afternoon. Thank you for those updates, Governor. I also want to publicly thank Dr. McDonald for filling in for me. He's one member of the incredibly talented and dedicated team at the Rhode Island Department of Health working on this response. As the governor said, we have 147 new cases today. This brings our total to 1,229. As the governor also shared, we sadly have 3 additional fatalities to report. 2 of these people were in their 70s and 1 was in their 90s, important members to their family and their community. One of the people in their 70s was a resident at Oak Hill Health and Rehabilitation Center in Pawtucket. The other person in their 70s and the person in their 90s were both residents at Golden Crest Nursing Center in North Providence. We now have a total of 30 COVID-19 associated fatalities in Rhode Island, unfortunately. One of the most important messages for us to get out right now is if you work in a nursing home or if you work in another healthcare facility, you need to stay home if you are feeling even the faintest of symptoms. The governor touched on this earlier. This is so critical for our healthcare workers who are able to do this. If you have even a tiny cough, you need to stay home. If you have a headache, you need to stay home. If you have an upset stomach, you need to stay home. Because of what we are dealing with, this is absolutely not negotiable right now. We need you to be thinking about the patients and residents in your care. And the best way you can provide that care, because we know all of our healthcare workers are committed to the patients and residents in their care, one of the best ways to provide that care is to stay home if you have any symptoms of illness. Additionally, people who work in nursing homes and other healthcare facilities should be wearing cloth face covers while out in public. The same goes for the other members of our critical infrastructure workforce. Who else is a member of our critical infrastructure workforce for Rhode Island? It's a long list. These are our firefighters, our people in law enforcement, our people in critical manufacturing fields, people who work in the food and agricultural industries, and many others. We have a list online that will be posted to really be able to apply the cloth face covering. It should go over your nose and your mouth and can be something as simple as a scarf, a bandana, or a t-shirt. As a reminder, these cloth face covers are not so much about protecting the person wearing the cover, but they are more about protecting the people around you. When we cough and sneeze, and sometimes even when we talk, germs can be spread if they are present. It's important to know that we should not be sharing these face cloth coverings. They can be washed after each use or at most each day. Separately, I want to add a few things on testing. One question we got a lot yesterday was, if I get a negative test, what do I do? If you got tested, you were experiencing symptoms of illness. That's the way the test works best. So that means even if you got a test that was negative for COVID-19, you still have symptoms of illness and still need to stay home. That means regardless of the result, you should not be going to work and should keep a distance from other people, even within your own home, and certainly shouldn't be out in public. The last thing we need right now is people getting other people ill with anything, COVID-19, flu, cold, or anything. A second note on testing. There has been a lot of information shared over the last few days and weeks about testing, including who can get tested, the fact that we have expanded testing, where to go to get testing, and what the process is, who to call to get that process going. If you have a question about testing for COVID-19, it's probably going to be answered on the dedicated COVID-19 testing webpage that we have online. That page is health.ri.gov/COVID/testing. The other thing you can do is just go to our Rhode Island Department of Health homepage, health.ri.gov, and click on the COVID-19 banner that's in the middle of the homepage. And then you can click on the testing tab on the left to get this information, which is available in English and in Spanish. Included there is also information about respiratory clinics. This is an important resource that we have here in the state that we want to bring attention to, because respiratory clinics have been going on for some time. We do credit the providers and the staff who have been staffing those so that you can have this resource. Respiratory clinics are urgent care centers and primary care providers in Rhode Island that have set up separate areas specifically for evaluating patients suspected of having COVID-19. We want to make sure that everyone in the state who has concerns and feels as if they need to be evaluated has a place to call where they can go and safely be evaluated for those concerns, or be referred for a test or actually swabbed at the respiratory clinic for testing. While these respiratory clinics are located in specific areas just for the patients who are being evaluated for COVID-19, it's important to know that urgent care centers are still open in their normal area to see patients who need other services in their usual locations. We have a list of respiratory clinics and their phone numbers online on this testing page that I told you about, health.ri.gov/COVID/testing. The key to remember is to call first. No one should be showing up to any healthcare facilities, respiratory clinics, urgent care centers, primary care docs, emergency departments. It's important to call first, and starting with your primary care provider is the best way to go, calling them. If you don't have a primary care provider, urgent care centers are available. It's also been mentioned that the Rhode Island Department of Health information line, COVID hotline, 222-8022, is available as well to help you be referred to the appropriate provider if you don't have one. These respiratory clinics are a different model. They're innovative. They're in response to this emergency. Similarly, the CVS drive-through testing sites are also a different model. We're one of the first states to do it. It's critical to expand access for everyone, and it's part of this emergency response. These are things we are doing now to respond with this pandemic. These are immediate-term solutions that you can see are in place across Rhode Island. It also allows us to highlight what the long-term solutions are, and it's continuing to have the incredibly talented and dedicated primary care providers who are out there doing what they do best, connecting with their patients, evaluating their patients, providing them the information they need, and making sure that they receive the treatment that they need as well. That's what we're all accustomed to, and that's where we want to keep going as we build out this system and make sure that everyone has the access they need across the state. We sincerely appreciate the patience, the partnership, the determination, the flexibility of all healthcare providers and all Rhode Islanders for that matter. This is how we need to be in this pandemic to make sure that we are as pinpointed as we can be in addressing the needs of Rhode Islanders. Getting through this crisis is going to require all of us working together. So each time we're talking to you about following the social distance requirements, the stay-at-home order, that's where you do your part. And we can know that healthcare providers across the board, in hospitals, in nursing homes and assisted living facilities, in ambulatory clinics, in these respiratory clinics, staff, everyone is playing their part to help make sure that we are all safe. So let's make sure that we continue to do this together.